Cellular injury. The basic principle: cellular injury occurs when a stress exceeds the cell ability to adapt. The likelihood of injury depends on the type of stress, its severity, and the type of cell affected. Neurons are highly susceptible to ischemic injury, whereas skeletal muscle is relatively more resistant. Slowly developing ischemia, for example, renal artery atherosclerosis, result in atrophy, whereas acute ischemia or renal artery embolism result in injury. Common causes of cellular injury include inflammation, nutritional deficiency or excess, hypoxia, trauma, and genetic mutation. Hypoxia. Low oxygen delivery to tissue important cause of cellular injury. Oxygen is the final electron acceptor in the electron transport chain of oxidative phosphorylation. Decreased oxygen impairs oxidative phosphorylation, resulting in decreased ATP production. Lack of ATP is essential energy source, lead to cellular injury. Cases of hypoxia include ischemia, hypoxemia, and decreased O2 carrying capacity of blood. Ischemia is decreased blood flow through an organ, arise with decreased arterial perfusion, for example, arteriosclerosis, decreased venous drainage, for example, Budd-Chiari syndrome, and shock. General hypertension result in poor tissue perfusion. Hypoxia is low partial pressure of oxygen in the blood. Partial pressure of oxygen is less than 60 millimeter hydrogram and saturation of oxygen is less than 90%. A rise with high altitude, decreased barometric pressure result in decreased uh, partial pressure of oxygen in blood and hyperventilation, increased partial pressure of s- carbon dioxide result in decreased uh, partial pressure of O2 in air, not in blood. Diffusion defect PaO2 is not able to push as much not to push as much oxygen into the blood due to thicker diffusion barrier, for example, intestinal pulmonary fibrosis. VQ mismatch. Blood bypass oxygenated lung circulation problem, right to left shunt, or oxygenated air cannot reach blood. Ventilation problem, for example, diathesis. Decreased O2 carrying capacity arises with hemoglobin, loss of function or dysfunction. Example include anemia, decrease in red blood cell mass, decreased partial pressure of oxygen, or a normal pressure of partial pressure of oxygen, and saturation also normal. Carbon monoxide poisoning is example of keratomalaysia and myositis ossificans. Carbon monoxide binds to hemoglobin more avidly than oxygen. Partial pressure of oxygen normal and saturation is decreased. Exposure includes smoke from fire and exhaust from cars or gas heaters. Classic finding is cherry red appearance of skin. Early sign of exposure is headache. Significant exposure lead to coma and death. Methemoglobinemia is iron in heme is oxidized to ferrum 3 state, which cannot bind oxygen. Partial pressure of oxygen is normal. Saturation of oxygen is decreased. Since with oxidant stress, sulfur and nitrate drugs, or in newborns. Classic finding is cyanosis with chocolate-colored blood. Treatment is intravenous methadone blue, which helps reduce ferrum 2, which reduce back to ferrum 2 state from a ferrum 3 state. Reversible and irreversible cellular injury is next topic. Thank you.